Doing, we're not doubling up.
So what would happen in the past is we'd all have our own care plans or individual recovery plans or individual treatment plans, whatever document it is for each service, to identify with the client what you're going to focus on. This document is an overarching document that looks at everyone working together on what they're doing. And it can be used across many different services, from mental health services, including PHAMS workers, clinical mental health. It can also involve the GP, drug and alcohol services, accommodation services. Anyone currently working with a client, that document can be shared with.
So the IRP is a really good tool to help set goals with the client and for the client, client-based and client-led. The IRP helps to focus where our work is going, and it helps the client sort of track where they're going and how far they've come with their journey on the road to recovery. It's great to share the IRP if the client likes with other workers who are involved with the client, so that the client feels well supported and everybody's on the same page. And it's great to reflect back with the client and look at, look, you've actually done this and this and this, and it's a really good referral to look back to.
And Knox Community Health Service had already engaged in shared treatment plans with Chandler Community Mental Health Team, and that had started a partnership arrangement between those services. And when the IRP, the Individual Recovery Plan, was rolled out for AOD services, there was a lot of consultation that needed to take place. And so I became part of that consultation process to be an advocate for the AOD sector around the things they needed in an individual recovery plan and respect for their role.
I think that's a huge value in that we can be flexible in our approach, particularly if clients are having difficulty in engaging, or having, obviously they're clients that with dual diagnosis often have complex issues, and so we can, share our knowledge and be flexible in what we offer, whether it involves more of us, we may sort of come to each other's services to see the client together. I think that can be a big value, so the client can see that we're working with each other and not across purposes.
Formal agreements established between Knox Community Health Service, AOD, and local mental health services have supported a range of activities encouraging a collaborative treatment approach. Formal and informal secondary consultations on a regular basis support mutual skill development and capacity for both AOD and mental health workers to provide co-occurring capable treatment and a no wrong door approach. This philosophy ensures that whatever door the client enters, whether it be the AOD service door or the mental health door, it will be the right door and the one that welcomes and provides empathy and hope, as well as a competent service response for both substance use and mental health concerns.
I think it engenders a real sense of confidence and security in the client to know that everyone that's supporting them is working together and that there's really open and clear communication going on.
A lot of referrals now from community mental health services. So generally being able to have that conversation from the get-go has been so helpful in talking about the history of that client, what are some of perhaps the experience that client has been through, to have that understanding coming into that work with the client rather than have them having to tell their entire story from scratch.
In my particular experience, I've had a client that was very ill with his mental illness and not able to sit in a room, and we weren't even able to do an assessment at all. It was far too stress provoking. And then for the last 6 months I've been working in a team case. I've been second consulting to his mental health worker. We meet every 6 weeks, and after 6 months that client has now started coming and seeing me. I've had 2 sessions with him. It's been very exciting to get him in the room, and he's able to now speak about his own drug use, and I'm able to ask him if he would like to come back, and he says yes, which it's very exciting, and it's because we've had PHAMS involved, Chandler House involved, and all that work has brought this young man to the point of being able to actually come into AOD treatment. And if we hadn't had capacity building for this man, he wouldn't be in treatment for his alcohol and drug use.
Been in previous roles where there wasn't that linkage with another organisation. It was the sort of fumbling in the dark type of situation. But now with our relationship with Knox, that's really improved. And also just with the way that dual diagnosis has been emphasised and prioritised as a really key, important entity, I guess, within Eastern Health, has brought about improvements there. And I feel personally that I've benefited from sort of greater exposure to the knowledge that's out there.
It's nice to have that sort of contact with mental health services and say, well, what's your experience been with that client? What has worked? What hasn't worked? You know, what can we do together to support that client from the get-go, rather than flinging back and forth between services?
We have found through that partnership, it's been a really helpful tool for us, especially with new clients and we're not sure where to go and what services that may be useful for them. It's fabulous for being able to have that kind of partnership where we can pick up the phone first and say, this is what's going on for this person, and get some help and some ideas, especially too if it's something that's not suitable for your service, then we're able to get some other ideas of where we can then look at going.
There's certainly been a lot more integrated work that's happening between agencies. The partnerships and the collaboration has meant that the person is receiving services, a variety of services, but they're actually talking together and working together. It's a collaborative, cohesive approach with very similar philosophies and methodologies, and an awful lot of sharing of information and ideas, and it proves that, you know, 2 heads are better than one. And I think the person receives a consistent service too, and there's not one agency knows this and another agency knows that. Everyone knows the person and supports the recovery for the person.
Training in mindfulness therapies has resulted in the implementation of 2 effective therapeutic group programs: an ACT therapy group called Wise Mind, Wise Choices, adapted from Spectrum Wise Choice group program, and mindfulness-based relapse prevention group.
And so clients can expect it's an 8-week course, 2 hours every per week, and each week builds. It's a skill-based group, so it's not particularly about a therapy group in terms of sharing your deepest, darkest secrets, though people do share very personal things with each other and experiences that come up for them. But that's not the focus of the group, so sometimes it can be quite emotional there, but that's not our reason for the group. It's a skill building group to teach mindfulness based skills to clients. In recent times, because mindfulness has become a legitimate therapeutic approach.
I guess at the beginning of starting the mindfulness based relapse prevention group, or the Recovery Mindful Way group, at the beginning of developing any program, I guess you do wonder, you know, how are people with mental health illnesses or conditions going to manage this, because it's very much about self-awareness, and were we actually going to generate uncomfortable thoughts and things like that in the room for them. But I think what's surprised us all is that the clients, even with co-occurring conditions or mental health concerns, have actually really embraced the mindfulness program really, really well. And if there have been issues come up, Neil and I are there as facilitators. They're invited to talk to us at any time before the group or after, or even give us written feedback on how they're going.
Including training in screening and assessment of co-occurring conditions, Knox Community Health Counselling and Drug Treatment team undertook a range of professional development courses in both evidence-based and new initiative therapeutic methods such as acceptance and commitment therapy and other mindfulness therapies. Local mental health partners were invited to attend the training provided by experts in each area. Training in motivational interviewing, ACT therapy training, professional resilience training, and a range of regional training events through the Eastern Dual Diagnosis Initiative increased capacity and confidence of staff from ATOD, PDRS, and clinical mental health services. The combined training supported staff networking and, most importantly, gave the various sector services a common language and approach when working together with clients and their families.
The team here at Chandler has really benefited from the capacity building that's been offered through Knox. One of the main things that they've been able to participate in is training. So they've done a number of courses now around acceptance commitment therapy, motivational interviewing.
I think training with all those different people, PHAMS and Chandler House and other places, it means that we can actually put a face to the names that we're already referring to. We know it's just building on those relationships, which I think is so important. We're trying to help clients form relationships, and we can, by our example, allow that to happen.
One of the really nice things about the relationship with Knox around the capacity building is that our clinicians can pick up the phone, and they know the people on the team there. So I guess there's some of the intangibles, if you want, that people know what's going on, that there's a greater connection that happens at all different levels.
It increases an awareness and understanding of what each organisation offers, and I think also it fosters a more consistent approach and good or high clinical standards across all the organisations.
So I find myself more hopeful in the sessions. I find that comes across to the client, that it feels like it's more workable, that you can just allow whatever's there to be there, that you don't have to kind of fix it or change it, but just I guess helping people come to terms with the reality of their lives and giving them some concrete skills and things that they can use in their lives. So yeah, I think it's changed my whole kind of way of thinking. And
what was great, just from the perspective that we work together with the same clients, and so that networking is always important. Knowing that we're on the same page as far as the therapy that we're doing is wonderful, because working in mental health, that's not the case always. And being able to actually sit down with your client knowing that they've just come from another session for another aspect of their work, and you're doing the same work, is wonderful. Being able to secondary consult with each other and have that real time happening instead of an old report that's 3 months old, or that's very, very special as well. The training that we've done with ACT and motivational interviewing has meant that there's also a consistent approach in how people are being supported, that there's not a clash of cultures, there's a similar culture happening in the teams, and so clients are being presented with a really harmonious style of approach, and I think clients benefit from that. It takes out confusion, they feel security, it's really clear who's doing what. We're drawing on specialists where needed, but that's being supported by the other services as well.
So when I was developing the training, I also was mindful that there were things that they needed to know within their role that were not necessarily things that I would normally have just taught people. I needed to understand the role so that then I could transfer the knowledge in the appropriate fashion. I wanted to help them to communicate more effectively with mental health services, and that was probably my main goal, really, out of all of this, that if they could do a risk assessment and they could speak some of the language of mental health and they understood the culture of mental health, then at the end of the day they were going to be able to convey the messages they needed to get better care for the consumer in the end.
It has such a positive influence on the team. We don't have huge budgets to be able to do team training and to be able to really skill up our workforce as much as we want.
Another important capacity building activity at Knox Community Health has been the implementation of a mentoring approach in partnership with the Eastern Dual Diagnosis Service.
The mentoring program aims at building skills and knowledge in